You know, I always love when I get that question about what is homeopathy, because I'm a Western trained physician, and it was at least, gosh, probably 15 years ago when I learned about homeopathy and what it can do. First, I learned that it's been around for over 200 years, and it uses highly diluted substances from animals, plants, and minerals. And it helps to kind of restore balance as well. So, very important thing to add to my practice. In conventional medicine, I have to think about some different sort of things. I need to think about drug-to-drug interactions. I need to think a little bit more about side effects potentially. And with homeopathy, that's something that I usually don't have to worry about because there are no drug-to-drug interactions. The other thing that's really good that I always can come back to is that it is safe. And that's something that's very important to me and obviously my patients as well. What I usually do as far as when homeopathy comes into play, I think about the symptoms in the beginning. So I usually think homeopathy first. Are there some things that I can do to make a difference, especially for like the cold, the flu, allergies, and that sort of thing? And then, for instance, if I have a patient or even someone at home that has maybe a fever for 48 hours or so, that's when I know, all right, maybe I need to think a little bit more of Western medicine here that may need an antibiotic or something like that. Kids are like little petri dishes. If you ever go to a nursery, they're touching things, they're rubbing their eyes, nose, and mouth. And keep in mind that viruses such as the flu can live up to 48 hours on hard surfaces. So it's usually because they're just not necessarily practicing high-end hygiene the way we want to. That's what we need to be thinking about, right? The natural ways to do these things. So one of the first things we need to think about is we need to make sure back to our hand washing hygiene, and we also need to make sure that we're getting enough rest. Now look, rest is extremely restorative. Believe it or not, it's just probably a little more important for our little ones to make sure that they're getting rest, and that's something that we can control. The other thing we need to make sure we don't miss out on is focusing on dehydration. And dehydration is important because when our mucous membranes are dry, it makes it a lot easier for viruses to get in and cause and wreak havoc for us. So it's important that we're focusing on that. Homeopathy helps a lot of minor acute ailments. It has a beautiful place for that. But once you start getting out to that 48-hour period and you realize that you're kind of going backwards and you're not seeing any improvement, that's the time you really have to make sure you reach out to your physician to better explain the symptoms. I'd love when I can actually blend the two because homeopathy does some special things that, once again, I mentioned, I don't have to necessarily worry about a drug-to-drug interaction. So it's perfect blend with conventional medicine when I have to bring that in as well. I think the important thing, especially for all you moms out there, you know, anytime you're pregnant or breastfeeding, we always need to let our doctor know, whether we're talking about homeopathics or even conventional medicine as well. So this is the exciting part for me, especially with us being in this season for the cold and flu season, because Boiron has some really, really special products that I like to bring into my conventional Western medicine practice. Now, the first thing you'll see back here is oscillococcinum. It's a long word, but you'd be surprised how many people out there know what oscillococcinum is. I love the fact that there's studies behind it that shows that it decreases the severity, but it also decreases the duration of illness as well when you have fevers, chills, and body aches. Remember, this is not a preventative, but at the first sign that you feel any of those things, we want to jump on it. The other thing I love about it is it's pretty easy for the kids to take. They're little micro pellets. They put them under your tongue. They love the taste. Now, how many medicines or how many treatments can we say that our kids love the taste? Not many. So it's really easy to get them to take this. It's safe for any of our children who are 2 years of age and older, okay? So, you know, there's not a lot of things that we can offer our kids when they're that small. And so oscillococcinum is a big one that's important. Now, Cold Calm will help us with any of the cold symptoms such as nasal congestion, runniness, sneezing. Now, the exciting part is that we can actually use these pre-measured dose vials or what have you. We could put that under the baby's tongue, and it's okay for 6 months and older. They're portable, so you could take them wherever you're going. You keep them in your purse or dad's in your wallets or what have you. But the point is, it's nice to have something on the go. Chestol is a special remedy that we use for, especially for cough. It's also for the dry hacking cough, kind of those coughs when you're starting up a car and you're trying to get over there. It's perfect for that. It's a honey based and it's safe for kids who are 2 years of age and older. Boiron has some really good products that can make it easier for us as parents. And my kids now, I always joke around that my kids are on a first name basis with any of these things here, so much so I have to dial them back because they're like, oh Dad, I knew I needed some Oscillo. So I got a little Oscillo. But the thing is, they were right because they understood the symptomatology they need to have in order to begin. It's kind of nice to have some things, especially during this time of year, that can make such a difference.